Hi guys! So I'm going to talk about a little bit about the engagement and assessment process that I use at the hospital at Benefis. So initially, as part of my job, we do the initial assessment with most of our clients. Each assessment normally takes anywhere between like 45 minutes to like an hour and a half, depending on how much the client really wants to tell us. And so we really rely strongly on the relationship with our physical therapist and our occupational therapist to kind of have these assessment conversations similarly, because there's no way we could cover all 170 patients in the hospital. There's only 6 of us that do my job, so that's a pretty unrealistic goal. So we kind of split those patients up with the OTs and PTs so that we can all kind of cover the assessment one way or another. So the assessments that we do are pretty straightforward. Our goal as transition planners is we work with the discharge planning in order to make sure that their transition from the hospital to wherever they're going post-hospitalization, whether it is a transitional care unit, whether it is nursing home, assisted living, home, or with a family member, wherever it is they're going is safe, it's effective, and it's the proper plan for them. So we ask things when they arrive to the hospital upon admission. We do the initial assessment that asks things like, where do you live? What does that facility look like? What is the layout? Are there stairs to get up to the front door? Are there stairs, down to the laundry? Is your bedroom on a level floor? Is it upstairs or downstairs? How do you do the stairs? Do you cook for yourself? Do you take your own medications? How do you fill your medications? Does somebody come over and fill your pill boxes for you? Do you fill them yourself? Do you use pill boxes? Do you use a walker? Do you use a cane? Is there somebody checking in on you? Just things like that, so that we can really gain the entire picture of what their home situation looks like. Because sometimes when they are leaving the hospital, that home situation is no longer safe. Whatever they were doing before hospitalization is no longer a safe discharge plan, which is often a very hard conversation to have, especially when they did come from home and they were living alone or they were living with their spouse. Excuse me. So that's where a lot of our difficult conversations come into play. Last week I had a client who had been diagnosed with pancreatic cancer, and she had a mass in her pancreas, and she also had a mass, I want to say, in her liver or something, and she had made the choice that she did not want to fight it anymore, or at all, and she was complaining about pain, so we were trying to get her to sign on to home hospice to manage that pain, and she didn't want to do that because her family was super unrealistic, and we had to have the conversation after a while and kind of be blunt and be like, the pain that you're feeling is only going to get worse. And those conversations are definitely really difficult to have, and I feel like it takes practice. And so I try to engage in those conversations as much as I can, and if it's another transition planner who is going to have that conversation, I try to tag along as much as possible, just because I think it's important to expose myself to really the crisis kind of emotions people display when you're telling somebody that they're probably coming towards death, and that's the reality of a situation. So it's pretty hard, and I think that the most important thing is to remain strong in those situations for people. They need somebody to be strong and to kind of lay it out on the line so that they can cope with it the way that they need to. It's kind of what I've learned through my experience at the hospital. So it's kind of how we engage. We are pretty straightforward in what we're doing. As soon as we enter a room, we say who we are, what, we're a transition planner, what our role is, and what our goals are within that position. And we work constantly with the family and the patient to make sure that they get to remain as independent as possible in whatever facility they would like to for as long as possible. And when that's no longer an option, we do our best to get them what they need, coinciding with what they want. So that's just a little snippet. It's kind of long, so I won't talk anymore, but if you guys have any questions, I'd love to answer them. Thanks, guys. Hope you're having a good weekend.